Good afternoon, everybody. Thanks for joining this afternoon. We're going to start in about a minute or two, just waiting for some for people to join. But yeah, thanks for coming. If you, we are going to record today's webinar, as you just heard. If you do have any questions for the team, then obviously use the chat function, or when we get to the Q&A section, you can unmute yourself and ask the team directly. So yeah, I hope you're really looking forward to today. We certainly are as well, and we've been really delighted to be joined by Sigourney from Radiant Science today, along with Dion, who's our head of medical operations. So just give us 30 seconds and we'll get started. Okay, great. Thank you, everybody. Right, we're going to get started today. This is the next webinar in our series, all about AI and the future of the medical PA in private healthcare. It's a really hot topic, this. We get asked a lot of questions about the AI and the impact it's having on private healthcare. So we're kind of zoning in today all around kind of the medical PA role and the difference that it can make. These webinars have been going on for quite some time now. I've been doing them since the beginning of 2024. They're designed to really help you through the steps that you will need to go through to plan, to launch, and to grow and be successful in private practice. So we help you understand all the different aspects that you need to think about, all the kind of common pitfalls and mistakes that we see week in, week out. The idea is really to help you save money and time when you're kind of setting up and launching and growing your private practice, helping you bring in those revenues quicker, and helping you build practice in your clinic as you start to kind of grow and scale your business. These are just a host of some of the webinars we've covered over the course of the last 18 months, everything from CQC, registration and compliance, which again is a really hot topic at the moment. We're seeing a lot of interest in that area. We've covered branding and marketing, how to pay less tax as a UK doctor, which will be coming up again early in the new year as we hit the end of the tax year. Exit and retirement strategies was last month. So a real wide range of topics. We've got recordings of all of these available. So should you want to see them and view them in your own time, get in touch with us at the end of the webinar and we'll be able to send those over to you. If you are unfamiliar with Designated Medical and looking at the attendee list, I think most of you are familiar with this, but we are a full service consultancy for private healthcare practitioners and clinics. So we're here to help you with every aspect of your private practice. The idea is that we can look after everything. You can pick and choose the services that you need to help you kind of scale and grow your private practice while you concentrate on looking after the patients and deliver the best outcomes. So if you're not familiar with us, that's who we are, and that's why we're doing these webinars. So this is what we live day in, day out. I'm delighted today to be introduced you to a couple of our speakers. Dion, you would have met before, who is our head of medical operations. She has a lot of experience over the last 20 years working in the private healthcare sector with many senior roles in and around kind of like the Marylebone and the healthcare district. She heads up our medical PA, practice management and CQC teams. Also joined by Sigourney Wable from Radiant Science, who is a real expert when it comes to AI. So we've invited her in today to enlighten us all in terms of what it can do for our businesses and our healthcare clinics, and obviously helping our patients as well. You'll be familiar with my dulcet tones. I host these webinars on a regular basis. So I'm the CMO at Designated Medical, and I spent the last 7 or 8 years helping doctors set up their own private practices. So that's a little bit about us. Now I'm going to hand you over to Sigourney now, who's going to tell you a little bit about her background, because I think she's got a really interesting background for you all, and how she's embraced kind of AI. So Sigourney, over to you.
Great. Yeah, thank you so much for having me here today. And yeah, very excited to kind of share some insights that I have from having worked in the space for the past 12 years, helping to build AI systems for hospitals across the NHS. I've worked at Great Ormond Street Hospital, National Hospital for Neurology and Neurosurgery, and Imperial College Healthcare Trust. I also have a PhD in AI and medicine. And I'm currently CEO of Radiant Science with my co-founder Felix, who also has a really extensive background in healthcare AI, building generative AI models for healthcare applications at Meta. And then we have fantastic doctors we work with, who are partners and also medical directors of the company, including Dr. Paul Bentley, who's a clinical academic at Imperial and consultant neurologist. And yeah, just very excited to kind of share some of the developments in the AI space that I've already seen are having a major impact on clinics. And also some of recent developments just in the last 2 years that you could be implementing in your practices today. But prior to that, I just wanted to kind of give a sweeping overview of how AI and machine learning has really changed over the past couple of years. I've obviously been in this space for the past 12 years, so I've seen the recent developments. But if we go back all the way to the beginning, about 40 years ago, we had reasoning from kind of fixed rules, so using if-then statements to be able to help diagnose things like infections. We then moved on to the machine learning era where we said, you know, are we able to feed the AI models data that we have available on patient variables and then have it predict outcomes? So really learning like how a human learns. And then we moved into the deep learning era where we really had the compute available in order to do more complex machine learning. And one of the incredible applications of this, and I'm sure you're maybe using this already in some of the NHS hospitals that you're at, but detecting things like cancer from medical images. And this is using technologies like neural networks, in which are quite similar to how our brain kind of sees and recognizes images. Then kind of more recently, moving into the generative AI era, I'm sure pretty much everyone on this call has used ChatGPT. And there's just been an incredible explosion in kind of using generative AI for clinic applications. We have a lot of unstructured data in clinical workflows, so long patient medical histories. You also have, you know, in a consultation, all that communication with the patient can be transcribed and summarized. So I think there's just incredible opportunity in generative AI. And one of the areas that I'm most excited by, which has only really been available since the last year, is agentic AI, which really leverages all the generative AI technology in order to be able to, in addition to creating and communicating like ChatGPT, is able to plan and act in real workflows. So it uses various tools that you have, your scheduling, your EHRs, in order to execute on patient actions and goals. And I'll talk a little bit more about this later.
So Dion, are you okay to just introduce us to what we're going to cover today? Oh, I think you're on mute, Dion.
That was a good start, wasn't it? Apologies. Okay, so today we're going to cover quite a few things. The impact of AI, how it's being used in healthcare at the moment. We're also going to discuss the reasons why some people might be a little bit hesitant to use it, and the fears and the myths associated with that. The history, the safety, which is a huge aspect for the healthcare sector. So Sigourney will talk us through the safety side. We're going to have a demo, which is great. So you'll be able to hear an AI agent speaking. I think he's called Paul. He's not actually related to our own internal Paul, but we can pretend for today. And then we'll be just discussing at the end how designated see the role of a medical PA changing in line with all of these really exciting new things that AI is bringing to the sector. So at the moment, probably the biggest question is, how can AI help my practice? Well, as you're all aware, I'm sure that transcription is changing very quickly. So we obviously in the old days used to have typists. I actually did that myself. We would sit with a pedal, and we've now moved on to digital, which is great. And everybody really embraced digital. And now, obviously, with the new AI age, we're looking at transcription services like Heidi, which I know a lot of you are already using and think is fantastic. In fact, I had a conversation yesterday with a clinician who told me that it absolutely makes her clinical notes better than she ever could, which I thought was a really honest way of sort of saying, you know, I do think this is a good system. Triaging, I think Sigourney can probably tell us a little bit more information about how it's being used in triaging, but it is already being used across the NHS and other practices. And then there's obviously streamlining your operations, so patient queries, telephone calls, bookings, the stuff that's really manual that takes your PA a lot of time can actually be outsourced to an AI, and it can be done more efficiently in a really good, positive way. It also helps with CQC compliance, which we did a webinar on recently. So if you're interested in that, you might want to go back and have a look. It makes CQC compliance really simple. And it gets rid of hours and hours of that manual labor of writing and updating and checking policies. So it really can be used in an array of services, and I'm sure there's going to be new ways of using it as it develops over the coming months and years. Common myths. So there's a lot of them at the moment. So we've picked a few that we know we've spoken with some of our clients about. Why are doctors not embracing? Well, there's a few reasons. Obviously, it's an AI agent, it's not human. And I think the biggest concern is that your patients want to hear a human voice with empathy. I think Sigourney is going to talk us through some of these myths as you know, the next few slides go on. But we can definitely get rid of that myth, because as you're going to hear for yourself, it's not a robot speaking. It sounds like a person, and we can even pick the language that they use. Patient experience, obviously, again, touching on what I just mentioned, empathy is a huge thing. Your PA speaks in a way that your patients feel safe and heard. Patient safety, so you're worried about the safety of your patients. Again, Sigourney's going to touch on this, so you will absolutely know that this is a 100% safe way of working, and the AI will only do what you want it to. Data security, is your patient data secure? Of course. And again, Sigourney's going to probably talk about this in more detail, because it's one of the biggest myths, I think, flying around, is that AI is unsecure. And then workflows. How will it disrupt your workflow? How will it integrate with the practice management system or other systems that you might be using?
I think over to you, Sigourney. Tell us a little bit about Radiant Science. I think, yeah, over to you.
Perfect. Yeah, thank you. I think one of the, as I mentioned earlier, like one of the recent developments and really one of the most exciting is the advent of kind of agentic AI that sounds human, is able to handle various tasks, such as overflow and after-hour calls for clinics. And yeah, so the problem statement that we really decided to focus in on, really from just having, working in the space for the last 12 years, talking to medical PA organizations like Designated Medical, and then just talking to doctors that own private practices, is that a huge proportion of patient calls currently are missed. And this is just by the nature of most patients calling up at peak times, at lunchtime, or after hours on the weekends, requesting information. And what we found is that a large proportion of patients still prefer to call, even if there's digital means available. With the long wait times that they might have on the call, waiting to be answered, or an unanswered call, this often leads to poorer patient satisfaction. That obviously impacts your satisfaction ratings for the clinics. And then from the PA side, they really have a lot of high value care tasks that they're trying to execute throughout the day. And having these calls constantly come in is really just a lot of interruptions to the flow. They might also be already handling a complex task on the call while another patient is calling up. So we decided to focus on this problem statement. And what we've seen with similar technologies implemented is that you can, for a small outpatient specialty practice, save up to $2,500 a month. So that's increased revenue just from the additional bookings that you would have otherwise missed from those missed calls. And it's not impacting patient satisfaction, actually having these zero hold wait times on on the call is increasing patient loyalty and experience. So now I want to kind of focus on one of the myths that we talked about around AI, sounding robotic and artificial. And this really was the case up until last year. We have seen an incredible improvement in the voice AI models, and these have been trained on realistic human voices. And these are kind of the agents that you can use to really communicate with patients and make it a more empathetic, human-like, natural conversation. So we'll play that demo now for a couple seconds.
Hi, you are speaking with Paul at Radiant Clinic. How can I help you today?
Hi, this is Felix Geilert. I wanted to book an appointment with the doctor.
Could you spell your last name for me, please?
Sure, it's Geilert.
Is that Geilert?
Yes.
Great. Felix Geilert, what brings you in today?
I wanted to book an appointment with the doctor for my cold.
Thanks for letting me know. Have you been a patient with us before, Felix?
No, I haven't.
All right, Felix. Could I have your phone number to set up your appointment?
Sure, it's 151124567
Thanks for the number 151124567 When would be the best time for you to come in for your appointment?
I was thinking tomorrow morning, maybe at 8 o'clock straight.
I'm checking availability for tomorrow morning at 8 o'clock now. Is there anything else I should note down for the doctor before I proceed?
Yes, I have a quite running nose, so if you can prescribe me something for that, that would be great.
Got it. I'll note your quite runny nose for the doctor. Just to confirm, you're booking an appointment tomorrow morning at 8 a.m. for your cold with Felix Geilert and the phone number 151124567 Is that correct?
Yes, that sounds correct.
We could go on, Sigourney, but I think that gives a good flavour of what it can do, which is incredible. So that, thank you very much for that. Okay, should we talk about patient safety, agent safety?
Yes, so this touches on another myth. I think kind of a critical thing to highlight here is that these are not just, a ChatGPT model just transplanted and working at your front desk, helping to answer the calls. We've spent a lot of time, and I think this is kind of one of the most exciting areas, is really how do you build these models to work in clinical scenarios where patient safety is so important for building trust. And we've been working with some of the top medical experts on this, on how to build the most appropriate guardrails, for instance. So I'll give some examples of just patient calls that we've already handled in our clinics that we're live at. So for instance, patients calling about urgent medication requests, and this is, out of hours on weekends, and we redirect those calls. So we have in place guardrails to say, if the symptoms are urgent, please call 999 or 111. If a patient calls in, and often, there's a wider range of what they could call up with. So if we're uncertain, or the agent is uncertain of what the patient is requesting, we have confidence scores in place to, ask for clarifications the same way a human would. And if it's unable to determine what the patient's intent is and thinks that it can't appropriately handle that call, it will take a note, hand that off to a human, and take a note for the clinical team. Another important thing is that patients often call up with clinical requests. And this is really important that that's handled by the doctor themselves. So all of that is always directed, collected, all the information that's required for the doctor to make a decision. And another important part about ChatGPT, I think, so if you've ever played around with it online, is that it tends to want to give an answer, even if it doesn't know the correct answer. And what we do with our systems is that we actually make it that it only gives information that has been provided by the clinic. So we work with you to put together, Q&As, information that you do want to offer those patients, and it never deviates from that information, and therefore never hallucinates like what you see in ChatGPT. And then on top of that, we have auditing of all the reasoning that the agent does. We have all the calls transcribed and the recordings available for you to review at any time point in the day. So in terms of agent safety, we've deployed this. We have almost perfect call handling now at our sites that we have, and we take this very seriously. In terms of data protection, we mentioned this before. I actually worked in a NHS organization that had a cybersecurity attack at one point, and the data for the patients was held ransom for a certain sum. They were able to overcome it, which was amazing. But we take this as, you know, a critical core USP that we deliver. We've already been NHS enterprise level approved. So we're working with partners in NHS GP practices. We've gone through all the processes with them to ensure all data is encrypted. Of course, you as the clinic always remain, and the patient remain, the data controller. So we only process it in order to deliver the services.
That's great, Sigourney. Thanks very much. It's a really good and a quick overview, I think, of what it's capable of, which is incredible. Dion, do you want to just touch on, obviously, you know, what we covered today around phone answering, around, you know, triage, around CQC compliance. Obviously, that's going to have an impact on the traditional kind of medical PA within a private practice. So perhaps you could talk a little bit about what impact this is going to have on the medical PAs as we move forward into the future. Oh, you're on mute again.
Love that mute button. We're already seeing a little bit of a change. So obviously at the moment, you know, AI is everywhere, and there are some people that are already using it. As Sigourney has mentioned, it's being used across NHS practices, hospitals, private clinics. And many are using it for, you know, the basic day-to-day things that would take a person a long time to do. So, for example, I think one of the biggest issues that our medical PA team have is rescheduling when cancelling clinics. This can be really lengthy when you're having to call 20, 30, sometimes 50 patients, and you already have all of the other busy tasks that you're supposed to be doing that day. With an AI agent, such as what Sigourney's talked about, we would be able to give the AI that job or that task, and they could rebook those patients. So it really can save your PA time. Now, the way that things are shifting is that instead of the traditional, I mean, if you take transcription as one of the biggest things, we already removed that from our PAs in the last 10 years. And they're no longer sitting typing, although I know there's some that do still like an audio typist. The majority of you are using digital transcription. So the PA is then able to focus on where your practice really makes the money, where the value really is, and that's the patients and the bookings. As that changes over the next, you know, coming years with AI, they may be able to transition into other more valuable tasks, such as assisting you with marketing, your patient feedback, live updates of your website. We're already training our PA team on how to use certain things such as Canva and ChatGPT, which will help them add value to your practice as things change. You know, a traditional marketing executive or a financial assistant, even a patient liaison lead, you would have this team of people that usually would be helping you with your practice. But I think as AI comes in, your medical PA would actually be able to undertake the tasks that other people might be doing for you. You might have a practice manager or a business manager. You might have a marketing executive. And actually your PA will be learning how to do these things, using all of the software that's available to them, and therefore adding more value to your practice. So yeah, things are definitely on the move and changing for healthcare.
Thanks, Dion. But perhaps we can just have a quick recap maybe of, you know, today's webinar and maybe the kind of key takeaways before we go into the kind of questions.
Sure. So we've looked at how AI can help you in all the various different ways: your phone answering, transcription, booking appointments. And we're talking about all the improvements that can make to your performance, your patient experience. patient safety, data security, all the really important things that you need to know about. And also we've discussed the challenging the myths and how to embrace AI and learn that actually the more you use it and the more you're open to it, the more value it's going to bring. The future of medical PAs is changing, as we've just discussed. And so, yeah, at the moment, I think they're the key takeaways. So if we maybe want to ask any questions.
Yeah, thanks, Dion Sigourney. Really interesting presentations. Thank you. We had a few questions beforehand, but please use the chat function or raise your hand if you'd like to. There's nothing there at the moment, but do feel free to pose your question. If you'd like to unmute yourself, in fact, we have Eleanor has got a question. So let me, Eleanor, I'm just going to unmute you so you can ask your question directly, or maybe, there we go. Do you want to ask your question directly, and then we can answer it? And can you hear us okay?
Hi. Sorry, yes. Can you hear me?
Yes, we can hear you. Yeah.
I'm ever so sorry. I actually clicked the the hand up button by mistake during the presentation. I'm so sorry.
Don't worry. Do you have a question you'd like to ask?
I don't, I'm afraid. No, it's all very interesting though, and it's in line with what I've been doing in previous companies before. So it's very interesting to see how other places are doing it.
Okay, fantastic. Thank you. Well, if anybody else has any questions, do feel free to put your hand up and we can unmute you, and then you can ask Sigourney or Dion directly. I think we've had a few that we always get a few questions obviously come in while we're doing the registration process. I think the first one was around customization, Sigourney. Maybe this is one for you in terms of, you know, how customized can you make this AI agent for your individual clinic?
Yeah, so we've worked with a multitude of specialty clinics, and as I said, also hospital and NHS GP, and they all have very specific clinic workflows and customizations and preferences. And we work with you, so we do a typical onboarding where we kind of collate all the facts that you would like to have the AI handle, all the information that you're happy for it to provide to patients. We work with you on optimal clinical workflows. We already have some templates in place, but if you want to customize that, if you want to customize the voice of the agent or the name, all of that is possible. And then we also demo that to you. We give you the live system. You can test it as much as you like, make as many modifications before going live at your site.
And correct me if I'm wrong, but can you mirror the kind of voice of the agent to actually mirror your medical PA? Can you do that?
Yeah, so interestingly, this is actually a possibility now with voice AI models. So you have different accents, as you heard. Paul has a British male accent, but you can also clone this to your own voice as a doctor or your medical PA. It is possible.
Amazing. I think, Dion, maybe you can handle this one, which is obviously going to be a cost attached to any technology you're bringing in to your kind of business and clinic. But how does it work in terms of the kind of commercial model and the cost to a clinic?
So it depending on how you're going to use it, obviously there's always a cost associated with everything. You may want to look at the value that it's bringing before you decide, but at the end of the day, the cost can be variable depending on which system or software you're using. It might be a fixed monthly fee, it might be a percentage, but I think a system such as what Sigourney is discussing adds around 20 to 30%. Is that right in revenue, Sigourney, or was it higher than that?
Yeah, so I mean, you would calculate separately for each clinic. So what we would do is typically we'd work with you to find out what is the volume of the patient calls coming in, how much. So from what we've seen across the board, 30% is the usual missed call rate. Then you calculate from there, you know, how much you charge per each consultation. And then you can work like very quickly to project how much that's going to save you per month. Just on a basis of if you miss 10 calls, each of them are 250 pounds, that's going to already cost you, add additional 2,500 in revenue a month.
Great.
Brilliant. Okay. I guess if you want to find out more and how it may, you know, the different kind of cost structures, do get in touch with the team and we can discuss that with you, with Dion and Sigourney. So you got to, you know, how well tested and reliable is it? You know, I know you've got more of a presence in the States, but you also got a number of clinics now in the UK that are using your technology. Is that correct?
Yeah, exactly. So we've already gone through the testing phase. We have all sorts of evaluation, performance metrics, which we're very happy to share with you if you're interested in diving deeper into that. And as I said, we've kind of got a number of use cases, both across specialty outpatient clinics in London, but we've also done some work with the NHS, which of course has these very high bars for reliability, data security. So yeah, very happy to share that after this if anyone's interested.
Yeah, and we spoke before the webinar, and we're just getting approval that we can send you perhaps some case studies and some examples of where you can see it live and in action. So if it is something you'd like to take a look at, then we can send that over to you once we've got approval, of course. And then one of the things that came up during the presentation was practice management systems, and obviously we've got you know, dozens and dozens of clients that we kind of work with, and they all use different practice management systems. Which ones does it integrate with right now?
Yeah, so we work with you typically to kind of understand your workflows. So for instance, outside of the practice management, you know, some doctors would prefer to receive notifications via SMS for certain types of tasks. Some would like email, some want everything in the EHR. So again, that's like a piece of customization that we would work with you to decide on. A lot of the cloud-based EHR providers also provide APIs that then you can access clinical data. So a good example would be Semble. They have open APIs. So for instance, when a patient calls up and they want to book in, you can just directly book into the practice management system.
Okay, brilliant. And the last question was all about how quickly can I get started? So if you've liked what you've heard today and you've overcome some of those myths that were in your head before you joined the webinar, getting started is fairly quick and easy, right? To demo and to get going.
Exactly. Yeah. So we do the customization process that I mentioned before, and that would be kind of a 1-hour session. Obviously, we're happy to go through multiple iterations if you want to modify the voice or the kind of clinic workflow logic that you're going through. We then just set up simple call forwarding from your existing call lines. And then, as I mentioned, we work with you to link with your existing systems. That's going to be very much site dependent because everybody's using different types of solutions there. So we would set that up for you. And then, you know, in as little as a couple of weeks, we should already be able to reduce missed calls to 0% and increase, hopefully, the amount of bookings each month and reduce call hold times to 0%. Sorry, 0%.
I'd imagine also that, you know, when you look at kind of like the calls that are coming into a clinic, that a lot of them are happening outside of typical hours. So a typical medical PA will work 9 till 5, 9 till 6, but I'd imagine evenings and weekends are kind of peak time for calls, which are currently not being covered. They're just going to kind of voicemail.
Exactly. And I think a good note to say is, you know, as I mentioned in the first slide, you have 70% of patients preferring to call. And the reason there is really that sometimes there's information that they need in order to first book the appointment. So you have a patient calling up and asking, you know, do you handle pediatric? This was a use case like, do you handle pediatric scans? And that wasn't part of the services that clinic provided. So I think a lot of people need that additional information to actually go ahead with the booking in the first place. And then another interesting use case after hours outside of just bookings is often patients running late, but these are evening clinics that people are doing after their NHS practice hours, and the medical PA office is closed, and the patient's, you know, running maybe 20 minutes late, and you can have all sorts of information that you can provide of whether you can still see the doctor, whether they need to rebook in if it's going to be an hour late. So all of these kind of informational or like urgent notifications on the information is important. We can also send messages to the doctor to let them know that the patient is running late at that point. So yeah, there's kind of a wide range of use cases that you can use it for.
Brilliant. I was going to ask also, does it integrate with things like live chat? Can you kind of have like a live chat interface alongside the phone system? So you can actually almost have a different interaction, a text interaction with the agent.
Yeah, so we had systems in place where we actually, so you mean like having all the voice interaction all recorded as a textual transcript?
Yeah, if I was to come onto the website and I was running late, or I wanted to book an appointment at the weekend and the phone number closed, could I actually have because a lot of people, I know from your stats, they prefer to phone, but there are increasingly people who like to text in that younger generation. So
100%. There's also very much like we see it as an omni-channel approach. As I said, like you can link as many tools as are feasible to link to the system. So some patients really wanted information sent directly to their phone. So for instance, if they were looking how to access their test results and letters, and they had lost the mechanism to get to the patient portal, they wanted that link sent directly to the phone so that they could just immediately log in via their telephone. So yeah, we kind of enable all of that, and we see it as this like multi-channel agent that can work across all.
Okay, amazing. Thank you very much. I think that is all for this afternoon. We normally do these in the evening, but today we did one during lunchtime because we thought it may work, be a better time to do it. If you do want to find out more about this, if we've you've really liked what you've heard today and you'd like to kind of trial it, or just talk to us about how this might work for your practice, do get in touch with us. We are partnering with Radiant Science and Sigourney, so we're able to kind of work with you and answer your questions. And we are looking, obviously it's a very new technology, so we are looking for clinics, our clients, to step forward and say, actually, this is something I'd like to explore. We can see there's already clinics, private healthcare clinics in the UK that are embracing this technology. So do speak to us. If you do want to just talk about your general kind of clinic, or you're just thinking about moving into private practice, just drop us an email at info@designatedmedical.com. We're happy to help. We can send you the webinar recordings. We know that we get really good feedback on those, and people enjoy listening to them in their own time at the weekends. Join our private practice WhatsApp group. We've got, I think, over 50 members now. We send regular kind of notes out. We share recordings. We try to get people to engage on different kind of topics. So feel free to join our WhatsApp group. There's a link there, and I'll send the PDF of these slides around afterwards. And obviously our webinar series continues throughout the rest of this year and into next year. So the next couple we've got are, obviously we've got the budget, and Rachel Reeves is going to present that, I think, on the 26th, of November. So I'm sure many of you are keen to know what she's going to come up with, and what's going to be leaked over the course of the next 2 or 3 weeks, and what does it mean for you as private practitioners. So we're going to do a session with Vicky, our CFO, on what measures are being brought in, what that's going to mean for you over the course of the next 3 or 4 years. So I think that'll be a really good and topical webinar at the end of November. And then we're looking, similarly to today, a sort of an extension of what we're doing is upfront payments. Not all of our doctors and our clients have this in place, but it's a trend that we're seeing, and there's huge benefits in terms of taking payment upfront from patients, having that integrated with your website so that patients out of hours can book appointments, take payments. Obviously, that means that the money is in your bank account from day one, rather than having to chase up aged debts and employing someone to do that for you, whether that's a medical PA or a billing company. So this is something we're embracing as a business, and we want to help and guide you through that process. So join us on the 11th of December before the Christmas period kind of kicks in. So that's what we've got coming up. I think in the new year, we've got more of a finance theme, I think. So we're going to be going back to kind of like the points of, how to save money, how to pay less tax. We're looking at the kind of new tax year and what to do with your profits and how you can invest that money wisely. So we'll return to those themes early in the new year. But if you do have any questions, please get in touch with us. Here are our details. You've met, obviously, Dion several times, and myself. Just drop us a call or an email, or visit the website and fill out a form, and we'll give you a call back. But thank you very much for attending today. A big thank you to Dion, but also Sigourney, for taking the time out to tell us all about AI today. And I've learned a hell of a lot, and I hope you have too. So until next time, we'll see you soon. Bye for now. Thank you to you both. Thanks for that. That was good. That was good, I think.
Yeah, thanks, Sigourney. That was great.
Thank you. Yeah, there's no other participants in the meeting anymore. Yeah.
Yeah.
I was checking. Yeah, thanks so much for having me. And I really appreciate, the time to kind of explain these things. Because as you said, it's just so important to have like the educational component there. And thanks for giving me the platform to do that. And I hope we can, start working together. And maybe we start even just with like what you mentioned, kind of the after hours transcription for all the different services. But very excited to keep discussing.
Great.
Yeah.
I think I think one of the things that would be really good, I think, Dion, is to educate our teams around this. I think we can encourage them to attend. I think the medical PAs and the teams that are working with their doctors, they can speak to their doctors about how this can benefit them. But I think rather than coming at it from a position of fear, which is I'm going to lose my job, it's more, oh wow, I can take all the way the stuff that I really don't like doing and find boring, and I can be doing really exciting work and really adding the practice. So
I think maybe once we've sent out the comms on the change of job, the change of role, then maybe what we could do is we could set up a session with either Sigourney or Felix or one of their team, where they could do a session with the medical PA team, talk them through it, give them a demo, and show them how it can support them rather than replace them. And I think you're right. If we can get them on side, they can then start pushing their clients with it. So I think that's a really good way.
Definitely. And they will have such a big impact. Like we're learning from some of the other sites that it was incredible to see the difference in like 2 different PAs. So one has a protocol for like explaining the treatments to the patients that is somehow returning like 20 more client bookings a month. And these types of like best practice, it's quite a large, like high volume clinic, but just the best practice of like how they're going through that call flow to really like mitigate and maybe also like mitigate concerns, but explain to the patient why this treatment is really critical for them. And I think, being able to feed those kind of like fantastic best practices into it, which would really come from like the top PAs that you have.
Exactly.
And Sigourney, do you operate outside of kind of healthcare? Like I'm just thinking about 360 wellbeing. Like we would we be able to kind of use that, because we've got a kind of phone system obviously, and it comes in and it happens all times of the day, and we can't always answer the calls, but it's a health and wellbeing app, but it has health and wellbeing kind of services within it. But I think it would be really useful to see that we could create that kind of round.
I think anything like super happy to explore that in a discovery session for sure. And we can talk about how it could be adapted, because what we see is as long as it's within the health, like well-being space, then that's fine. Like we have functional health and more kind of like we have another site that's probably going to be starting that's more in this, repeat patients basically being able to contact the GP practice at any time point throughout the month. So it's like a subscription type model, which I think links quite similar to what you're doing, where they kind of get this constant access throughout the year to different services. So we are exploring that. We already have one site that we think would be a very good fit for it. And I see no problem with like just adapting the workflows a little bit to work for
we should definitely explore that. I've got a call this afternoon with my team, so that would be really exciting, because I know one of the things that the CEO really hates as a startup is that he's basically on the phone all the time and getting interrupted, and like actually there's a lot of the questions are really basic that we get asked. So I think there could be a real solution there for us.
It's definitely also, it's like figuring out what questions are best suited for humans, and then what makes most sense to automate. Like if it's something very easy that you can immediately provide, that's great. And then everything else, if they're happy to just get routed, that person is already unlocked to take those more complex calls. So that's what we found, especially like in GP, where you get a very high volume about, for instance, like directions, that doesn't really need a human to explain the directions to the site, but they weren't able to find that information online. So those, super happy to explore how we could work on that.
Okay, brilliant. I'll let's organize a separate call about that. So maybe next week. But again, I'll let you go and have your lunch. Thanks again.
Thank you so much.
Lovely to be able to do that with you.
Thank you,
guys.
Thank you.
Bye for now. Thanks, Dion.